Today's topic is going to be about our lower back. For those of us who have any version of lower back pain at any point in your life, today's goal is to kind of shine some light on what you're experiencing, what muscles are involved, and how I can help to not necessarily take away the pain, but in this specific instance, try and prevent it from either A, getting worse, or B, having you have just an amazing core. And we're going to talk about core and what it really does. So, lumbar spine injury prevention. I talked a little bit about the objectives. I'm going to talk to you about the muscles that make up the lower back trunk area. I'm going to talk about abdominal drawing maneuver versus abdominal bracing. That's a real big factor in terms of knowing what you're actually activating and what you probably aren't, okay? I'm going to talk about a few common injuries that you guys will come across. They have fancy words, but it's stuff that we're familiar with. I'll talk to you a little bit about how you can actually assess yourself, what may be going on, and then at that point we can talk and, hey, this is what I did, this is what I think is going on. The more you know, the better. It makes my life easier. And then lastly, we'll talk about injury prevention exercises that you guys should be familiar with. I'm going to talk about progression. One thing that I get, not necessarily a lot of, but we actually talked about it yesterday. When you are working out or you're just standing there and you might have stepped wrong or turned wrong and you feel something catch or lock up and you can't move, those things are an insidious onset, and I really don't have the best explanation. But what we can do from ground zero, quote unquote, to now, right? I'm going to show you a progression of those exercises. All right. Moving on from there, let's talk about the actual muscles that make up the trunk. Okay, or the core, should I say. You have they're broke up into two systems, and this is just a general understanding of what is going on with what we know, or what is known as local muscles, and I'll talk to you about what those are, and global muscles. And if you look at in the parentheses, local is purely for stabilization, but in a static setting. So right now you guys are seated, that's what is static. And then if we go to the global muscles, those are what we would call our sexy muscles, our six-pack. Those are the ones that are like, yeah, I want those to really shine. But that's not necessarily the case. They do stuff. We need to have a strong core. If you don't have a core, which is these two systems, then your spine would just kind of be stacked on top of each other, and you hope for the best that you can stand upright. Okay? So these are the two systems that I really want to dive into today. And I'm going to talk about the importance of them, but now you have an understanding of of the two systems and what they're for. So without looking, what is the local muscle for? Local muscles. Well, thank you for answering. Stabilization, and then, well, I already uncovered global. But global is those large muscles that are in charge of power and things like that. Is there a reason why on the left the spine's all jacked up? Well, so, yeah, it's a great question. If you look... Exactly. If you look at, and I'm going to dive into it, and I'll kind of touch on it right now. If you look at let's start first with the local, they are actually attached to each vertebral segment. So those muscles are imperative to work. And if we don't turn those on and you're loading your spine, this is what could potentially happen. So if you take away these local muscles, your spine is just going to be stacked onto each other, right? So let's just say you have a sexy pair of abs, right? A six-pack. But you don't know how to turn on those local muscles, well, this is what's going to happen. You're eventually going to have a version of back pain. So those physique models that have that insanely ripped presentation may have a terrible presentation of back pain because they don't know how to turn on these lower back muscles. Y'all tracking? Great question. Okay, so let's move on. Let's dive into these muscles now. And the definition's there, but I'll read it off to you. These muscles have shorter muscles, and if we look back here, they're obviously going to be a lot shorter. These are what the local muscles look like. The global have longer levers, okay? So going back here, there are shorter muscle lengths. They attach directly to the vertebrae and primarily responsible to generate sufficient force for segmental stability of the spine in the static position, okay? There's a little bit more facts that I'm going to drop on you later, but I want to make very, very clear that these smaller muscles are imperative to help prevent injury or at least have you last longer without any back pain if you have history of it, okay? So these are the 7 muscles that make it up. The first one is one of the most important ones, and I can't harp on that enough. The multifidus, if we look at the multifidus, it literally originates on every vertebral segment, but it goes from the sacrum all the way up to the base of your head. So you're talking about stabilization throughout the entire spine. okay? Working our way down to the internal oblique, external oblique, those muscles line your ribs. That helps with helps with breathing in conjunction with the diaphragm. The quadratus lumborum is a fancy muscle. It's not up here, but it lives on the sides where our internal and external obliques live. We talked about the diaphragm. And then lastly, your pelvic floor muscles. Male and females have pelvic floor muscles. We always, or I don't know if we always hear, but pelvic floor kind of gears more towards women's health, but males need to learn how to turn those muscles on as well. We have those. And an example of pelvic floor muscles is a trampoline. Okay, you have the black part, that's your muscle belly that lives down in this area, and then those coils are the muscles that help keep everything tight. You imagine those coils tend to stretch over time. Well, that's what happens when we get a little more mature in age. Those coils tend to start stretching too much, and then we have what we call incontinence, where you can't control when you void, aka go to the restroom, things along those lines. Everyone tracking in that regard? So these are the local muscles. They're very small. Just remember that. And the importance of them are what? They help you stabilize in what position? Static. Okay? Sitting, any version of not moving, these need to make sure they're turned on, because when we go on to, well, let me segue it. Before we go on to the global muscles, in order for the global muscles to actually work appropriately, you need those local muscles to work, okay? I'm going to talk about some little things that I think are very, very interesting to the transverse abdominis, and those are those small spider-like muscles that are attaching to each segment, okay? So moving back, or moving forward to these little fun facts, the TRA and the multifidus, which goes from where to where? The multifidus. I just talked about it. Entire spine. You got it, okay? Those two little muscles are huge. So when you look at these, they are made to, or they activate up to 100 milliseconds before you actually move. Okay, so when we're doing squats and you have that bracing maneuver, they're still different, but the minute you engage by drawing in that belly button, that's gonna help stabilize that muscle. So when you're about to squat, these are already turning on for you. When you get to the bottom of the hole and you're talking about butt wink and things like that, well, where does the multifidus go? All the way through to the bottom of your spine towards your sacrum. Now, there's also the other muscles that are involved, but these muscles are imperative to turn on before you go through the full range of motion, okay? So when you're about to squat, they're already activating for you. The minute you draw on your belly button, just simply drawing in, not bracing just yet, they're already going, right? You turn this on and they're right when you squat, you know that these are activated, but you got to know how to do it. Going down to here, we talk about, I didn't mention, but they're the deepest of the abdominal muscles. They sit, they're the ones that literally attach to that spinal column. If you look straight through me, you're going to see them, okay? I talked about them. These are just fancier words for attaching to each vertebral segment. And then the multifidus, I already mentioned that. They go through the entire spine.
So is that multifidus, is that just like one muscle, or is it like individual muscles on every single vertebrae?
Both. So you have one long string, and then from that string sprout out the rest of the multifidus. That makes sense? Okay. So we're going to transition from those smaller, deeper finite muscles to now the larger muscles. We talked about the sexy muscles. Here's the six-pack. We do have some overlap, right? I did mention the external oblique on the other side, but I did want to give you at least a better picture. You can see how these striations are going down, and then the internal oblique actually goes up. Can y'all see the difference? Y'all are lying because I can't see the difference. But they're different, okay? So you have the external oblique goes in, right? They cause an X, so anytime you're exhaling, that's your external oblique firing. And when you're inhaling, that's your internal oblique firing. What are the importance of these muscles? Well, if you can't take a deep breath, or if you strain one of these muscles, try taking a deep breath then. You can't. It's painful, right? So if you have a rib out of place, if you get punched in the stomach, something like that, that's when these tend to be a problem. Otherwise, they're just imperative for breathing, which is important. Erector spinae muscles are the ones that just sit superficially, like those round, hilly muscles in your lower back. Those are just as important as those local multifidus muscles. And then the iliocostus is literally lining the entire spine. Okay, fancier names, but the two that I want you to pay attention to, or the main one, is going to be the rectus abdominis. Biggest difference between these muscles, you have larger, longer lever muscles, right? And then if you go to the local muscles, they're smaller, shorter lever muscles, okay? So now that we know going into these two systems, the global muscles, I already talked about the larger lever. And so all of these movements, do they use both systems or just one? Both systems. That's not a trick question, guys. You use all your muscles in your core, your trunk. And these are the ones that we don't necessarily get commonly exposed to, but when you're trying to challenge your core a little bit more, of course you're going to work your way overhead. And then when you start going into an ab mat sit-up or even something like a GHD, all those muscles need to be working as a team, because if they don't, then we start experiencing a version of back pain, or if you have history of back pain, these can be the movements that can create more of that discomfort, okay? So common pathologies, let's kind of transition into this really quick. They are fancier terms: spondylosis, spondylolisthesis. When I was learning this back in PT school, my biggest feat was learning how to spell it, right? The only thing I really want you to take from these terms are the progression of it. So spondylosis is literally the wear and tear that our back has to go through every day. I am 32 years young, and that's how I'm going to term it, but I have 32 years of wear and tear on my spine. That's just what it is. And as we progress in age, we have that wear and tear that's necessary. You need that joint approximation in order to keep your spine healthy. Joint approximation is just that natural bone-on-bone impact. We need that. Let's progress now to the spondylolisthesis. This is what you see more in your gymnasts, your higher impact Olympic lifters. Anything that creates that sudden force and hits that lower spine, you're going to look at segmental movement that typically occurs at your L5, S1, which is lower in your spine. So if you think about any type of overhead movement, if you don't fire those two systems, the likelihood of this happening is not super high because you're not powerful in it, so to speak, in comparison to a gymnast. But these are some things that can happen. And going back to learning how to fire those smaller muscles that, again, attach at these segmental properties, we can essentially try and avoid this occurring. If you don't turn on those muscles that are attaching to each of these bony prominences, this is what could happen. This is not to scare you. This is just to shine light on those importance of those two systems. And the smaller muscles are which ones? Just name the general term. What's the smaller? That you're giving me specific. Local, right? The smaller muscles are the local muscles. And so these are imperative for these type of things, these ugly presentations. You don't want to see that. And you won't see that if you fire those local muscles in combination with which other system? Global. Very nice. Y'all are still on track. So let's keep moving forward. Another common injury, we've heard of this, right? Can someone read this off to me? That's the one that I hear common. I think I have a herniation. I think there's a disc that's moving or a bulge or something like that. And you can see the progression. You can see how you have a normal disc, which looks nice and pretty, everything's smooth. Then you have a degenerative disc where it starts that normal wear and tear. Do y'all remember that fancy word that I said? Spondylosis. That was a fancy word for just wear and tear. So we're now working our way into it. Some people, have anyone heard of degenerative disc disease? Docs love to talk about that because you just need to hear that there's something going on, but that doesn't mean pain. As long as you're firing the muscles that help protect your spine, we should be okay. Moving on to the bulging disc, you can kind of see how it's protruding. It can go any direction. And then this is the one that I'm going to dive into, that herniated disc. You have the terrible example that's been used across the board is a jelly donut, okay? You have a disc, which is the breading, and then you have the nucleus pulposa, which lives inside of that jelly donut. I tend to go to it because it's the easiest thing to remember and to explain. You have compression, that jelly-like substance protrudes out, pushes on your nerve, creating pain, which can have radiating symptoms down your leg, etc. The only importance that I want you to take from this is that you can have a herniated disc but still not have pain. If it herniates and it doesn't really push, or it doesn't push on that nerve, you're fine. 1 in every 5 people have a version of a herniation, and you may not feel the symptoms. It's not hitting on the nerve. I don't want you to directly relate herniation with pain. You don't have to think of it that way as long as we are firing what two systems? Global. You guys are awesome. You're going to leave here knowing that at the very least.
Like about to herniate? Is that what it looks
Exactly. Yeah, and you can kind of see how it's going to progress into this larger presentation. Okay. So moving on, let's see, how can you assess this? Let's see how strong your core really is, right? It's not necessarily going to tell us that we're going to get, I'm not telling you an assessment of how to see if you have a herniation, right? Besides symptoms, back pain, Okay, those are things that I just want you to be thinking of. If you're presenting with this, it might be because we're not working through a test like this. This is called a double leg lower test, and it's exactly that. Okay, what you're looking at is that abdominal draw-in maneuver, not necessarily bracing, right? Where you're creating a Valsalva maneuver where you're pushing and you're increasing intra-abdominal pressure in your thoracic cavity. You're just simply drawing in that belly button to turn on our local system. Okay, so I'm going to give you the general synopsis. This is a detailed explanation of it. You draw in that belly button, and you should be able to, if you look at normal through poor, you should be able to get to about this range and not have your lower back come off the ground, okay? So if you're way in this range and your back's already coming off the ground, that's speaking to those two systems that aren't firing appropriately, okay? So this is gonna let us know, hey, I got some work to do, and eventually you should get to where you're in this range, and it's one of those indicators that you may be less prone to injury. Going on to the next one. This one is a combination of assessment and an intervention. Same concept. You want to make sure you draw on that belly button. The only difference is now they have this version of a blood pressure cuff. You put that blood pressure cuff underneath your lower back, and then what you do is inflate it to a certain level, 40 degrees of mercury, something like that. It is 40. And then you have to maintain that pressure and be able to move your legs through a progression of where you're just extending your legs on the floor, then you got to lift your legs off the floor, then you got to eventually get to the double leg lowering, but this is just a more detailed way of doing it. Okay, so the only thing I really want you guys to worry about would be this. If you want to assess to see where you're at, this would be something more of, I would kind of facilitate this for you guys. Okay, so we got this test that I kind of want you guys to dive into, and we don't have to do it today. Challenge you to do it at home, see where you're at. Okay, and the way I want you to do it is try and think about segmentally moving through a chunk of space, a chunk of space, a chunk of space, and then the chunk of space above the ground should be about yay high. If you can't get close to the ground anywhere near it and your back's already arching, let me know. We can talk. Keep it simple. And let's talk about these exercises briefly. Abdominal hollowing, or the draw-in first. What you're doing, and I want you guys all to do this with me, you have what we call your ASIS, the bony part of your hips. Go ahead and touch that for me. Now what I want you to do is go finger breath in, meaning just slides right inferior and inferior right inside. Okay, don't dig too deep, just rest your hands there. Now what I want you to do is actively think about this, draw your belly button in. Do you guys feel anything come up into your fingers? Relax. Good. It should be subtle. If you draw on your belly button too much, it's almost going to move further away from your fingers. You should just simply draw in that belly button, and you should feel that activation of your TRA, transverse abdominis. Bony prominence, slide those fingers, finger breath in, belly button in, and you should feel a difference in the muscle activation. Okay? That's what I want you doing here. You can do this at home. I challenge you to do this at home. Do it in a hook-lying position, so that way you can actively feel that muscle. Sitting up is a little harder to do, but I at least wanted to give you the landmarks. And I gave you a rep scheme, and I will email this out so we can review that later, or that can be reviewed later. Sauerman progression. Remember I told you it's an assessment. It's also a treatment. So you can see legs touching the ground. Now it's lifting completely off, what we would call double float phase. And then now you're going into almost a bicycle. Level 5 is your legs are in a straight, long lever, and then you're going to work through that motion. Then this one's a good one. We've done it. We've seen this here. We've seen a lot of these. Well, maybe not so much here, but we talk about it. These are super good for being able to turn on not just the muscles in front, but the muscles in back. Those are just as important. Okay. This is hollow to arch transition. If you notice, beautiful here, abdominal draw in, and then you want to try and activate by rotating and maintaining that hollow position and finish in arch, in the arch position, right? These are really good to do at home, right? If you're lying on your back, maintaining and then rotating, and then go back the other way. Those are going to help work all the muscles. Okay? Let's move on from here. So the muscles that make up, remember I talked about the side part, the quadratus lumborum, internal, external, oblique. The glutes are also just as important. The side plank progression, remember if you have that instance, which I hope it never happens to you guys, where you can't move, where you're stuck, A, you want to try and move through it the best you can, and B, you want to work on activating those muscles under your own volition. You turn them on, turn them off when you want, not when the pain tells you to. Okay, and that's a different animal. But these are a progression of side planks. You guys are familiar with that. I love these because they're total body, and I like this depiction here. You can see what muscles you're using. It's a ton. Same concept here. I didn't have that cool picture there, so bear with me. I like for us to go above a minute and a half. Try and keep that in mind when you're doing these muscle groups, or these exercises, excuse me. So you have side plank, plank, the chop and lift. The cool thing about this is that you can do it in two variations. You can actually rotate to use those internal and external oblique muscles, or you can stay nice and static and then make your arms work around the spine. So two different variations. You can see how he's rotating, excuse me, and then you can keep this nice and still like they're depicting, and then moving your body. So you can work, excuse me, internal versus external. Okay? So biggest thing here, we're working all of this trunk. This trunk is your actual thoracic spine. The core is living right in here, down to below the belly button. Okay? That's it, guys. This is my contact information. You know how to get a hold of me. I just thought the picture was cool because it's looking down, so I wanted to point that out. Thank you for noticing that. I also like to provide my references, just so you know I don't make it up. Okay? I'd love to offer time for questions. However, I ran out of time.